You're watching the Fox 5 Morning News at 7.
Live look from our SDCCU.com camera. Good morning to you, sunshine. And I mean sunshine. I mean sunshine. A lot of it. Hot weather continues in San Diego this week. I was hoping for a break. Dr. Richard Chaffoo joining us now to explain the dangers of overheating. I really tried to do my part, Dr. Chaffoo, and turn off the air to help with the electricity. But my goodness, everybody started getting angry in the house. And you could see the kids starting to struggle. I mean, you try to help, but you got to be careful.
You do, and it's a balance, Shally. You're absolutely right. You know, we're actually all there's a risk for all of us. You know, during this time of overheating. So it's something that I think people think about. You know, for instance, your children and my children. Obviously, they're at more of a risk, Shally, because they don't have the reserve. But you know, people that are over the age of 65. Have underlying medical problems, cardiovascular, pulmonary disease. And remember, people that are on medications for high blood pressure, especially diuretics, will tend to make one a little dehydrated. So all those are really people that we need to look out for and watch for during this heat wave, that being at an increased risk.
Yeah, and those people are already at the increased risk dealing with this pandemic right now. They're forced to stay at home, they're indoors, and then they need to be careful about being too hot and overheating. So what are some symptoms? What would they be feeling if they do have any type of heat-related illness?
So, Shally, I think there's a couple take-home messages, is that it's a spectrum. So what may start out initially as like some heat cramps, where you may just, you know, being exercising and you may get excess sweating and muscle pain and spasms early on, can then lead to something called heat exhaustion. So if you ignore those symptoms and continue, you know, being exposed to, you know, the hot temperatures, you can see increased sweating, cold, pale, and clammy skin, usually moist. The pulse will rise up. You may get some nausea, vomiting. You may get some further muscle cramps and some weakness. Your body is telling you at that point, Shally, you need to cool down. You need to cool off. You need to take a break, because unfortunately, if you continue with like vigorous exercise at this point, or say if you're working in your gardening, or if your work takes you outdoors where you're exposed outside for long periods of time, the next step beyond heat exhaustion. So say if you, at that point, the best thing is obviously you want to drink fluids, you want to get to a cool place where there's some shade, you want to stop your activities and really rest and recover. If we push ourselves, say, to that next level, we get to something called heat stroke, which can be basically a medical emergency. And this is where actually our body core temperature rises because we're unable to accommodate this excess heat. So we'll see our temperatures getting up to 103 degrees or higher. And instead of the skin being kind of cold or clammy or wet, it tends to be more hot, red, and oftentimes dry, because remember, we become dehydrated. You know, the body is trying to preserve all that fluid. Again, the heart rate is high, is elevated, and very importantly, we start to have some confusion. You know, we're a little confused, and you know, in a more extreme case, there's loss of consciousness. This, Shally, is truly a medical emergency. So if someone is suffering from heat stroke, that's the time to pick up the phone and call 911. Because that person needs to get to a hospital, they need to be monitored, they need rapid cooling fluids. But it all starts very early on, you know, with those heat cramps and not listening to your body and not following what your body's telling you as feedback.
And speaking of listening to your body, Dr. Chaffoo, I know Chrissy has talked about it time and time again on the show about staying ahead of it. By the time you hit some of these symptoms that you're talking about, I mean, part of it could be a little too late, right? You should have been doing the water and staying out.
Exactly. So important. That's a great point, Shally. Most important thing is you need to stay well hydrated, and that does not mean caffeinated drinks. That does not mean a cold beer, as good as it might taste. You really need water. Even sugary drinks are not really as good as just plain water. We want to replace what we've lost. And you're right. You know, keeping your eye on the news with Chrissy and knowing about the heat index. That times of day, Shally, where we're most often at risk are when the sun is at its zenith or peak. So anywhere from about 10 in the morning to about 2 in the afternoon, that's the peak time. So really, if you can limit your outdoor activities and say if you have to exercise or have to work in your garden or something else of that nature, or being outdoors for extended periods of time, do that in the early morning hours, before 10 a.m. or in the early evening. Those are great times to exercise, and you're much less likely to run into these issues of heat cramp, heat exhaustion, and heat stroke.
Now we're doing the face masks, which often I
Yes.
hear from people that they say they wear them, they feel like they can't breathe, they're overheating. Is that
Yes.
something that it's okay to still wear in this heat, or do you recommend you just stay indoors, stay cool, and take the mask off?
Well, we're in a pandemic, of course, so we have to use our best judgment, and obviously the social distancing and the wearing the mask, the washing our hands, which we've talked about so often in the program, are very important to spread the surge. But the problem, as you said, is in the heat. We tend to get overheated with these masks, whether it's just a face covering or these N95s. And if you're feeling overwhelmed, if you're feeling heated, again, if you're having some of these early symptoms, then that's a time to get to somewhere safe where you can remove your mask. Oftentimes outdoors, away from other people, where it's cool, and removing your mask, again, getting that water bottle, drinking your fluids. Once you've collected yourself, you're feeling better. Obviously, you want to put your mask back on if you have to go back indoors, or when you're outside, if you're around more than 10 people, you want to find somewhere that's not really very crowded. So again, it's these common sense tips are very important, but in the context of the pandemic that we're all involved in right now.
Dr. Richard Chaffoo, good advice. Always good to see you. Thank you.
Good to see you.
Time now for your morning weather.